Ladies and gentlemen, welcome to the men's room. As a moderator of this session, I have to introduce myself. My name is Michael. I'm 49 years old. I have been dealing with Scleroderma since for 17 years. I was 31 when I was diagnosed. And I have also a heart transplant due to heart involvement on Scleroderma. And I'm going to be your moderator today. So the last men's session, it was six years ago. It was a discussion between men about their problems, about their sharing their stories. And this time we upgraded the session. We have a clinician here who's going to talk about the specialities of Scleroderma in men and about the differences between Scleroderma in men and women. And I'm very curious on his lecture. His name is Alain Lescoat. He has focused on systemic sclerosis for over a decade, emphasizing its impact on quality of life and exploring occupational exposure, such as silica exposure affecting men with Scleroderma. He's the head of the Scleroderma program from Rennes University Hospital in France. I hope I pronounced that right.
Yeah, perfect.
And was visiting a scholar at the University of Michigan in the US. He has published more than 50 scientific articles on Scleroderma, and he is a member of the scientific committee of the French Association of Scleroderma Patients. So Alain, the floor is yours.
Thank you very much. I'm really honored to have the opportunity to give that lecture. I already have my microphone. So I'm really honored to have the opportunity to give this lecture today. And this is going to focus on the quality of life in men with systemic sclerosis. And I really want to thank the organizer, the FESCA, the Association des Sclerodermiques de France, and the World Scleroderma Foundation for the invitation. So I have no conflict of interest. So first of all, my presentation is not going to be men against women. This is not the objective. And the other point is I really think that the voice of patients really matter, and I won't speak on behalf of patients. This is not the objective here. But I will take some quotes from existing articles from the literature to give you some experience from men with Scleroderma. So I'm not speaking on behalf of patients, and I hope we will have a discussion, at least some of us at the end of the presentation. So a quick word on epidemiology. So as you know, systemic sclerosis is a rare autoimmune disease characterized by fibrosis, for example, of the skin or of lung, and of course vascular involvement. And it is more frequent in women than in men, as it is reported between 3 women for 1 man and even 11 women for 1 man. So amongst autoimmune disease, Scleroderma, the prevalence of men in Scleroderma is not the lowest, because it's even lower in systemic lupus or in Sjogren's disease. So they are men with systemic sclerosis. It's not that rare, actually. So the best example I could give is, of course, Paul Klee, who was the ambassador from the World Scleroderma Foundation at some point, and he is the demonstration that there are men with systemic sclerosis. So one particularity of systemic sclerosis in men is that the disease used to be more severe. Here is an example of the cohort from Norway, which is a nationwide cohort, meaning that they have the ability through their healthcare system to record every patient with Scleroderma. So it gives us a real picture of the epidemiology of the disease. And as you can see, female represent 83% of the patient, meaning that 70% of the patients are men in this nationwide cohort. But if you look at one severity marker of the disease, which is diffuse cutaneous involvement, meaning proximal skin fibrosis, you can see that in that case, female represents 67%, meaning that the percentage of men it is much higher than in the overall population, meaning that men are more frequently have diffuse involvement, diffuse cutaneous involvement. And this is also true, for example, for interstitial lung disease. So more fibrotic manifestation in men than in women with systemic sclerosis. So now, what are the specificities of SSC experience in men? Because the World Health Organization suggests that men and women need their own health strategy. That means that we need to have a specific focus on disease experience depending on gender. So for that, I've used one of a recent paper from the literature, which was published by Michael Hughes' team from UK in collaboration with a partner from the US, who tried to explore the experiences, the coping styles, and the support needs of men with systemic sclerosis. It was published in 2023, and it was based on focus groups of men with systemic sclerosis. So what are focus groups? These are discussions between patient and with a question guide, so they would know what type of topic they should be discussing about, and they have put it 25 men with systemic sclerosis during 7 focus groups with 3 to 6 men per group, so they would have discussion about their experience of systemic sclerosis. So the way we present the result for these kind of analysis is that we provide a conceptual map, meaning we highlight the key themes about living with systemic sclerosis when we are men, and they highlighted 3 different themes. First is the impact of the disease on masculinity. The second theme is how to deal with scleroderma when we are a man, and also the discussion about the support for living with systemic sclerosis and how men ask for different support than women. So first, the impact of systemic sclerosis on masculinity. So the first theme that was highlighted was that the disease impacted the roles and activities of men, and especially when men were defining themselves as with their job. They said that the disease prevent them from doing the job they used to do and had impact on everyday life as a worker. So this was one of the aspects. And the other aspect is that most of the time, men don't want to show that they have a disease. They don't want to highlight this in their working and living experience. The other aspect that was highlighted on masculinity and systemic sclerosis was that there was, of course, an impact on sex, intimacy, and also on erectile dysfunction. So I want to have a little focus on erectile dysfunction because actually ED, for erectile dysfunction, is frequent in the general population, even outside scleroderma. So do you have an idea of what would be the prevalence, meaning the percentage of men with erectile dysfunction after 40 years old in the general population? Not in scleroderma, but in the general population.
20%.
Okay, 20%? 40%?
I was also thinking about 40%.
40%. Well, that's the actual real number. It's 40% in the general population, so not in scleroderma patient, but really in the general population. So it's actually frequent. What I want to say here is that erectile dysfunction is not all about scleroderma. It is favored, unfortunately, by scleroderma. So probably we know that the percentage of male with systemic sclerosis have a higher percentage than the general population, but it's still frequent outside scleroderma. And the problem is that a physician, most of the time, they don't ask the question during the consultation. So this is something that we need as physicians to work on to better take care of that manifestation of the disease in scleroderma patient. So the other aspect about masculinity was that Scleroderma impacted masculine self-image, meaning that some aspect of masculinity were impacted by Scleroderma, and that the men wanted to highlight that in some way they had to renounce to some of what defined them as men, actually. And they highlighted, for example, that they may look diminished as if they were never learned to throw a ball. That was an example. They could play football anymore, and football is really kind of a man sport, and that Scleroderma was impacting this way society sees men, but also how they feel as being men. So that was one of the example. The other aspect is that, of course, the disease had an impact on their everyday life outside being a man, just the everyday life in general. And I think for some women in the audience that this is something that is actually quite similar between men and women, and I'm sure that some women will recognize themselves in what the themes that have been highlighted. So the first is that you need to always be prepared to anticipate everything when you have Scleroderma. When you need to go outside, you need to think about the gloves. When you will have a great dinner, you need to think about the reflux, and you need to anticipate everything. If you have diarrhea, you need to be, when you enter a place, you need to know where the toilets are just to be sure to get them on time. So there's this idea of anticipating always in the everyday life. The other aspect is that considering the complexity of the disease, the heterogeneity of the disease, different manifestations for different patients, the male that were interviewed highlighted that they were becoming expert of their disease, and that taking care of their symptoms was kind of a job, an everyday job, just to be able to manage the disease. And the other aspect was that men with Scleroderma have to balance priorities, to make choices and to renounce to some of the things they used to do in the past, or to prioritize other aspects of their life instead of those they had in the past. So another way of saying that the disease is impacting their everyday life in general. So now regarding support for living with systemic sclerosis. So there were three themes again. The first is it was hard to talk about Scleroderma. This is something they said that because men don't talk or they don't really open up, but it's hard to express themselves about the disease. So this is something that was also mentioned by women, but it is more frequent in men because of the image of men in our society maybe. So they don't complain, so they don't talk about systemic sclerosis. The other aspect, they need to have some help, but they reluctantly accept to have help because they're men, they can manage themselves their problem, they can deal with their problem themselves, but actually with Scleroderma it's not easy to always deal with this problem, and this was one of the other aspects that was mentioned. And regarding the kind of support men with systemic sclerosis prefer, it was highlighted that they were asking for a careful education about the disease, as if to keep their own autonomy, so they could still be doing things themselves. So I think it's connected with the two other themes in some way, but they were asking for more education about the disease. But I think it is also true in women, but this was highlighted here in this work on men with systemic sclerosis. So these were the main themes from that article that emerged from these analyses. And the last theme, I think it is also important, is that they were facing an uncertain future, and there was concern about future and uncertainty. It's hard to predict disease trajectory, to predict the complication of the disease, and for that reason, uncertainty is a burden in the everyday life of men with systemic sclerosis. So now if we look at this study from the University of Michigan, which was also a qualitative study about symptom experience of Scleroderma, including men and women, you can see that actually the themes were quite similar when it comes to uncertainty, but also to the impact on everyday life with the need of avoiding triggers, meaning always being prepared, the mean of adapting and coping in everyday life, which is quite balancing priorities, studies. So it's actually quite the same theme that emerged from some experience of women with scleroderma, meaning that there are obvious overlap between men and women, and that the impact of masculinity is, of course, something more specific to men, and with the importance of erectile dysfunction. So another aspect which is specific to men with systemic sclerosis is that in men, scleroderma can be an occupational disease. So I'm talking about that because I come from Brittany, which is on the west part of France, and we are quite famous for our stone cutters. And stone cutters in our region are exposed to silica dust. So what is silica dust? Is actually just stone dust. Many of the stones are actually have a high silica content, and there are many jobs and many occupations which are responsible for silica exposure, and it's almost it's in more than 90% of the case, these are men who are exposed to silica. It's not a common exposure in women. So it's known for more than 1 century because it was described in stone masons, but also in gold miners. But actually, even in the current era, silica hazards are still topical, especially in the construction industry, but also more recently due to the use of new, what we call engineered stone, which are artificial stone, which are a stone designed with a high silica content that are used, for example, for stone benchtop in kitchen or in bathrooms, for example. And these stones with high silica content have been banned in some country like Australia, but they are still used in other countries, and they are responsible for outbreak of autoimmune diseases like systemic sclerosis. So it is a topical issue, and still something that we will probably deal in the coming years. So what is the percentage of men with systemic sclerosis who have been exposed to silica exposure? So in these studies, for example, from Canada and Australia, it's almost 30% of men with systemic sclerosis who reported silica exposure. In France, it's almost 50% of males, so it's very frequent actually. And in Belgium and Portugal, it's up to 75% of men. So it's a very common exposure, and there is a causal link between silica and men with systemic sclerosis. So this is a nationwide study from Denmark, also highlighting the high prevalence of silica exposure in men and the association between silica exposure and the onset of scleroderma in the general population, highlighting that there is a real connection between that occupational exposure and systemic sclerosis in men. So now, what about research and how men are represented in research? So you can see that actually, although men represent 17% of scleroderma patients, in research they are well represented with here in the tocilizumab study, more than 20% of the participants were men. In the nintedanib study and the mycophenolate study, it was 25% of men who were the participants from these studies. And in the stem cell transplantation studies, it was even almost 40% of the participants who were men, highlighting that there is research ongoing and that these studies include men with systemic sclerosis, which is, I think, an optimistic concept. So to conclude, scleroderma is not uncommon in men, with up to 20% of scleroderma patients being male. Erectile dysfunction is among the bothersome symptoms of scleroderma in men, and we need to talk about it, and physicians need to be aware of that problem. Scleroderma is an occupational disease in men, with about 30 to 50% of men with systemic sclerosis with a history of silica exposure in epidemiological study. So it means that we need more prevention to limit the onset of systemic sclerosis in these male workers, but also maybe to prevent the progression of the disease in male who have systemic sclerosis and who works in the silica industry. Research is ongoing and includes a significant proportion of men, with from 20 to 40% of participants, and new treatments are validated almost every year, so there is room for optimism. So I want to thank you for the invitation again. Thank you for your attention, and I want to thank the FESCA and the World Scleroderma Foundation, and also the French Association for Scleroderma and the Michigan partners, the association from Michigan. Thank you very much.